So if you're a mom who is struggling with getting your abdominals to feel strong again, look more toned, and maybe you're trying all these different things after pregnancy, but it's just not working, well, keep watching this video. I'm going to talk about what a diastasis recti or abdominal separation actually feels like, and also how to assess for it on your own to find out if that's truly the issue and what you have. So what I'm going to talk about affects so many women, and actually myself, I went through this after my second baby, who was 9 pounds. I had quite a big separation between that area, and going on to become a pelvic floor physical therapist and specialty in postpartum, I was able to solve this myself and then also help many other women be able to heal it without surgery. So there are a lot of natural ways and exercises and things that you can do, including pelvic floor physical therapy, that can help heal a diastasis recti. So I'm going to talk about what it actually feels like when you have one, because I hear the common complaints over and over again, these frustrations of postpartum moms, women that come to me, and sometimes it's not immediately postpartum, but you may be 3, 4, even 10 years possibly down the road after having a baby, but you're still struggling with connecting to that area and doing abdominal exercises. I think it's really important to note that after 6 to 8 weeks, that's the time after, in that immediate postpartum stage, you really want to give yourself some grace there. You've just held a baby for 9 months and your belly was growing and growing, and almost 100% of women will have a diastasis recti or see that down in their midsection. They'll see that ridge there during the 3rd trimester of pregnancy. So give yourself that good 6 to 8 weeks to really see what your body is going to do on its own with healing. But after that point, then we would assess and see if this is something you need a little more guidance for. The number one thing that I see women for, and also what they come in complaining about, is they still feel like they look 4 to 6 months pregnant, even though it's been a while since they had their baby. So seeing that belly pooch, not really being able to tone their midsection, that is the number one thing that I hear from women. Also, after you eat, you just feel a little more bloated, distended belly. That is another thing that a lot of women can feel if they are dealing truly with a diastasis recti. They will see that tenting, doming, ridging if they go from lying down to sitting up. They'll notice that their belly just pooches out rather than how it looked pre-pregnancy. So that is another common thing they'll see as well. Maybe you are trying everything with diet and exercise. Give yourself some grace also too if you're still nursing. So during that period of time, your body's going to hold on to a little more belly fat because it needs the fat stores for continuing to produce milk. So give yourself a good 4 to 6 months after breastfeeding to really see if the exercises you're doing is going to work as well. But for many women that are not nursing and down the road they start doing more core related exercises, or they feel like they aren't sure if they should be doing these crunches or planks or different exercises in a fitness class, there's a lot of, just concern about what's right to do, what's wrong to do. There's a lot of misconceptions on the internet about diastasis recti. But those are some of the common things that women are feeling and going through if they truly have it. So one of the things that we want to do is just understand what actually is diastasis recti. And you have your superficial abdominal muscles, your rectus abdominis, and you have connective tissue that goes down that midsection. So that connective tissue in the 3rd trimester of pregnancy especially is going to thin and it's going to stretch, and you will get that bigger separation between that area there where the connective tissue is lengthened. Now, when you are activating those muscles, you see pooching out, tenting, doming, you see that ridge come up, and that separation there shows that you don't have as much connection in those core muscles. You have a deeper layer, your transverse abdominis muscle, that lies deeper, and that's really what we're going to work on and treat and heal in order to get the more superficial abdominals to look more toned and also feel like you're bringing it together rather than pushing it out as well. Now, your abdominals are just a piece of the pie when it has to do with the whole core. Your diaphragm's at the top, your pelvic floor muscles are at the bottom that hold your pelvic organs and affect bladder leakage, and then your back muscles in the backside too. So sometimes women will feel back pain or they'll have leaking that coincides with having a true diastasis or that abdominal separation. Now, I think it's important to note that time, consistency, doing the right things with repetition over a period of time, and adding in some weight training and other things that are going to strengthen and tone that whole area from your back and your glute muscles and your hips is all going to be crucial to helping this heal in a more natural way. So there are many factors involved in actually healing it. What I'm going to teach you is how to assess for it on your own and see if this is something that you might have to seek some guidance with. So I'm going to show you, lying on my back, what it actually looks like to assess for a diastasis recti on your own to see if that's what you might have. So on your back with your knees bent, you're going to find where your navel is. You're going to take 2 fingers. I'm going to go an inch above, and right above my navel, I'm going to bring my chin up toward my chest like a little curl up. And from there, you may feel both sides of your rectus abdominis. You can kind of feel the ridges there on the side. You may see or feel the tenting or doming, and you'll see how many fingers you can fit in that space in a perpendicular manner. So when you go in that space, if you can fit 3 fingers, or you can fit 4 fingers, 5 fingers, whatever that is, that would be, if it's more than 2 fingers, usually considered more of a separation that can require some treatment. Now, if your fingers, not only the width, but also the depth, how far down that they sink into that space is truly the most important, because we want that deeper layer to almost give you a hard stop. If your fingers go all the way down to your top knuckle here, then we have some more work to do. And it's even possible at that point, if you go get assessed in person by someone that's a pelvic floor physical therapist, or you find that you're doing the traditional things that aren't working for you, there's only 2 cases out of hundreds that I've seen that truly did require surgery. But if you're able to tense that area and pull your navel in toward your spine and then do a curl up and you feel those deeper muscles actually activate, then you have a lot of potential for this to heal. So I think it's important to know that you need to go below the navel an inch or a couple inches, right at the navel, and then also above. Assess those 3 areas and see how many fingers can fit in that space and how far down they go to. This is one of the ways that I assess my clients, just one of the ways. But that's a good self-assessment that you can do on your own. It's also important to know that your pelvic floor, those muscles I talked about in the hip region, that really comes into play. So if you are having any bladder leakage problems, you're having pain with intercourse, anything like that that's related to those pelvic floor muscles, being able to treat those, because that has to do with connecting to your inner core, then that can make a big difference as well in healing your midsection. So you can find a lot of different programs online with doing exercises for postpartum healing or helping with diastasis recti. But you want a thorough approach. If you're really seeing more than 2 fingers, if you have 3, 4 that you can fit in that space, this is not going to heal on its own, and you need some professional guidance. I have another video that you can go back and watch after this called 4 Ways to Heal Diastasis Recti Without Surgery, and truly helpful and gives you some ideas of things that you can start doing on your own. But it's consistency over time, and it's not a quick fix. But you can definitely do a lot to avoid an invasive surgery and really tone your midsection. It may take a little bit and you have to be patient, but it truly does work. I had 4 fingers you could fit in that space. I worked with weight training, I did breathing exercises, changed my posture, really paid attention to how I was being mindful about doing core related exercises and not going right into sit-ups and planks and the things I truly couldn't feel if I was engaging right away. So everyone needs a little bit different approach, but I think it's important to know it truly can heal. And I know from personal experience and working with hundreds of other women who have seen success. So I would love for you to understand what diastasis actually feels like. And just a quick recap, if you're seeing that tenting, doming, that ridge down your midsection when you go to sit up, you're feeling extra bloated after you eat a meal, your belly's really distended, besides screening for any digestive issue that may be a problem with your deep abdominals, you still feel like you look 4 to 6 months pregnant, and you've tried all different things with your diet and exercise after you stop nursing, but it's still not working, then those are the common things that women feel if they truly have a diastasis recti. So I hope you enjoyed this video and learned something. Comment below. Let me know what else you want to learn about this condition, as I have lots of info to help you. And let me know what else you want to learn by commenting below, and I'll respond and we can go from there and film another video about it. Thank you so much. And if you have not subscribed to our channel, Level 4 Women's Health, please hit subscribe. We have more great info about postpartum care, Pilates-based exercises, and other women's health tips on this channel. So thanks for watching.